Good morning, good evening, good afternoon. This is Dr. Garias for MED120 Medical Terminology. It is now week 8, module 8. And if we look into the module for this week, I believe it is obstetrics or reproductive. Yes, it is. And please, regarding your medical language laboratories, if you don't see a grade, the critical listening exercises, I don't see everything. Some of you have partial. I've got some of you have some messages out, but I'll look into it further. But look at your assignments. If you haven't gotten grades, either in the medical language lab section or within the Moodle, please shoot me an email with a screenshot, and you could press Control Print Screen if you're on a PC, or Shift Command 4 if you're on a Mac. Okay. And building words and labeling, remember, this is like optional, but this is the stuff that I need to see. The critical listening exercises 1, 2, and 3, response exercises 1 and 2. Okay, and again, for whatever reason, I can't see it all. Now, the discussion for this week is going to be a little bit different. Oh, I did not add it. Okay, let me add it right now. Well, the discussion for this week is a little bit different. Discussion 8. Now, research the most common medical abbreviations for obstetrics and gynecology. Create a 10-item quiz, multiple choice format, utilizing solely these medical abbreviations. Okay, of course, it's due next week. Let's post it. Maybe I forgot to click post. Could have sworn I did it. So let's just jump right in. And here. Okay, so obstetrics, whoops, wrong. Chapter 8, reproduction. Now, obstetrics and gynecology, OB-GYN or OBGYN is two services in one. So someone who goes into obstetrics or goes into gynecology, you're going into both. So the obstetrics is for any female who's pregnant or wants to get pregnant, and gynecology is for any gynae, any female issues, right? And anything that deals with anything regarding female, and that's including urinary tract. Now, for male, it's typically urology, low G study of uro or urine. So and they deal with the kidneys, the ureters, and the urinary bladder, and of course the urethra. But they also deal with fertility disorders regarding male. Now, if it's a fertility problem, it's the Department of Obstetrics that deals with the female patient. But nowadays, there's a subspecialty called Uro-obstetrics, where that particular person can see both male and female patients regarding fertility. That's why when you go to a fertility clinic, you're not seeing a separate urologist and a separate obstetrician. Okay, and all these people are MDs. All these people, urology most likely went through internal medicine first, but not necessarily. Now, these are nice pictures, nice to know, but you'll definitely need to know them a little bit better when you get into anatomy and physiology. But I like these pictures because, again, like I stated in other lectures, many medical terminology and anatomy physiology classes are fused. So you go through, both things at the same time. But here at our university, we separate it out just to warm you up, and also when you go to anatomy and physiology, it it gets solidified and renewed. That's part and parcel of education, is the repetition of it all. So amniocentesis, we already know that from week 1, week 2. Centesis, surgical puncture of the amnion or the amniotic sac. That's the sac where baby floats around in. And remember, anytime we do centesis, it's a surgical puncture. That means it goes through a surgical process, right? There's a pre-op, intraoperative, and a post-op. And the function of any centesis is we want to get a sample of something. And the function of amniocentesis is to see if baby has any genetic abnormalities or any biochemical disorders, so that mommy and baby and mommy's partner can also be, have the heads up. But in my experience, many patients usually waive amniocentesis. Also, it's scary. Even though it's ultrasound guided, you're pretty much putting this huge needle in your belly, and it's kind of, pregnancy is already scary enough. It doesn't need to be any more scarier. How do I? Okay, good. Cervix, again, could mean neck, like in your cervical collar or your cervical vertebrae, but in obstetrics, we're talking about the neck of the uterus. If we go back up here and we're looking at the uterus itself here, do you see how it forms like a narrowing right here? You got to use your imagination a little bit here. And that's your this area right here. See how it narrows down? That's your cervix. So if you have cervicitis, inflammation or infection of your cervix, right? Most common in sex workers. It'll be in that area, and that's also the area that we use a screening test called a Pap Smear to screen for any abnormal cells, and is a nice screening for cervical cancer. Also for HPV, human papillomavirus, which is a very good precursor to an indicator for cervical cancer. Now, the vagina is not the hole or the orifice. The vagina is also referred to as the vaginal canal. It's a muscular tube which, when mommy's pregnant and having delivery, that's where baby passes through. And you could see how it's like ridged so that it can expand, kind of like an accordion. If that's, I'm trying to put that in the most polite way possible. But remember, when you look at anatomy and physiology, it's where form meets function, and you could see there's a reason why it looks the way it looks. And the vaginal canal can accommodate a baby. So and that's where we pass a colposcope, and the colposcope will help us visualize the area, especially of the cervix here, for the Pap smear. And the Pap smear typically takes the internal and external part of the cervix and a little bit of the vaginal wall. Vaginocele, herniation of the vagina. Now, what's a herniation? Herniation means, let's see if I can, why will it not let me go back up? I always have to refer back to this picture. Here you go. See the anus and the vagina? They're tubes. Not the anus, but the rectum and the vagina, they're tubes. Now, you see all these muscles here? All these muscles here and here and here, that's all muscle. It forms the pelvic floor. Now, what happens when mommy has a lot of babies? That floor stretches, then shrinks, stretches, shrinks, stretches, shrinks, and it gets loose. So herniation is when something's sticking out where it shouldn't be sticking out. So you'll get a vaginal or rectal prolapse. These tubes will start slipping through and falling out, right? And that's called a prolapse or a herniation, right? So it's now maybe you're more familiar with the hernia in your abdomen or your groin. It's the same thing. You have tubes, namely your intestines and your spermatic cord, right? Might be sticking out where it's not supposed to be sticking out, and then it causes pain. And this situation is kind of a little dangerous because now the outside is now sticking. I mean, the inside is now sticking outside, and it's a point source for infection. Galactorrhea, lactogen, rhea, abnormal flow or discharge, galact, milk, right? And lactogen, that is uh, anything that produces, gen is forming or producing milk. So lactogen is anything that signals or hormone that signals milk production. And maybe you recall from the endocrine chapter that lactogen is called prolactin. It's a hormone. I believe from your posterior pituitary. I could be wrong. So that's milk, and but gen is more common with maybe you've heard the term before. You probably definitely heard the term before. Pathogen, uh, forming or producing patho or disease. Gyneco, women, female. Hystero or utero deals with the uterus. So, ladies, someone calls you hysterical. I'd start questioning that because what do we know as the typical layman's term for hysterical? Someone who's crazy or someone who's going off the rails. And they're going off the rails because you have a uterus. So it's a little bit anti-feminist there, in my opinion. Hysterectomy, ectomy, removal of hyster, your uterus, and we could do that if there's cancer or um, if polyps or multiple reasons why you would want to remove your uterus. Uterovaginal, pertaining to the uterus and vagina. Wow, what is up with my? Okay. Now, where are we? Mammogram, right? I hope you ladies, especially after the age of, I believe it's 30, 35, should be getting a radiograph or an x-ray of your breast. That's when they put your breast in between the two plates and then they do an x-ray. That's a mammogram. That's a screening exam. And please note that a screening exam is not the same as a definitive exam. So if we see something abnormal in a mammogram, it doesn't mean you have breast cancer. We see something wrong in the mammogram, then we do what? We do a biopsy. Same thing with the Pap smear. If we see something abnormal in your cervix, that doesn't mean you have cervical cancer. It means we should really investigate it. So we do a biopsy, a cervical biopsy. Okay. Now, mastopexy, if I go through a mammectomy secondary to some sort of cancer, I remove my breast, I now have to perform a mastopexy. So any other tissue that I have there, I have to go make sure that's that it's in the right place and that it doesn't move around. Remember, nose job and a breast job or a boob job, a layperson might say it. That is what? Mammoplasty. Okay. Menorrhagia, your menstruation, menses means monthly. Your menstrual bleeding is too much. It's bursting forth. It's hemorrhagic. It's not good. Right? See your gynecologist about that. Uterus, endometritis, meter. So the uterus has different levels and different layers. So the endometrium is the inner layer, and you can get inflammation or infection within the endometrium. You also have the perimetrium, which is the tough outer layer, and the myometrium, which is the middle muscular layer. So you could see there on your anatomy and physiology classes And for your future classes, utilize your medical terminology powers so you can understand. You don't have to memorize. You kind of know what the words and what the layers actually mean. Prenatal, postnatal, perinatal, al pertaining to when you were born, right? 004, that's your ovaries, right? You could have a tumor in there, oophorectomy, and then we must perform an oophorectomy if it's malignant or it's bad. Ovariorectus, because if I don't, there will be rupture of the ovaries, and that's not good. And especially if it's a young person, that person will now be in danger of not having children, which is infertility. In means no or not. Salpingectomy, removal of your fallopian tubes. Now, we can remove everything, and that's called a TABSO. TAHBSO. So let's look at that. Let's look at that 25-cent word. And total abdominal hysterectomy with bilateral salpingo-oophorectomy. Right? TAHBSO, and sometimes we call it TABSO. Total abdominal hysterectomy. That means I open you up via your abdominal cavity. What am I doing? Ectomy. I'm removing your uterus. With what? Bilateral. Bi means two. Later means side. Two sides. So I'm removing two of each. Salpingo, which is your fallopian tubes, and oophore, which is your ovaries. So what are we removing? 5 things. One uterus, 2 fallopian tubes, and 2 ovaries. Okay, so that's a nice trick question, and that's what TABSO is. And we do that for extreme cases, either cancer, polyps, and so on and so forth. Right? Okay. Now, vulva. Vulva is part of the external anatomy of external female anatomy, and there could be diseases associated, vulvopathies. Now, episiotomy, the best is to look at a picture. Now, let's look at the definition first. Tomy, to cut. That means I'm not taking anything out. I'm just cutting. And it's incision of the perineum. So let's look at that, because the picture is a better way to explain it. Now, especially with newborn mommy, or maybe if the baby is too big, right? This is what I need to do. See, baby is crowning, right? Now, this is your perineum. This is the vaginal orifice, and this is the anus, right? So what needs to happen, right? I take a Mayo straight scissors. Curved. Use curved. Right? Well, last time I remember, was it curved? Yeah, it should be. Right? Now, you can do a middle one, and you could do medial lateral. Medial means middle to now. This is the patient's anus, and this is the okay here, and this is the vaginal opening, and of course, fetal heads coming out. Now that's when baby's ready to go, right? We either cut here. I like medial lateral; it's less damage, and also midline episiotomy. You have there's a greater chance of rupture going straight all the way to the anus, which is not good, right? And that's what an episiotomy is. I have to cut that in order to facilitate a baby coming through there, because the vaginal canal is very, very flexible, but the vaginal orifice is not. So that's why we have to do that, especially with firstborn or primigravid babies. Okay, so that's what episiotomy is. Arc, beginning, so menarche is your first menstrual period. Now, PG, gravida, and primigravida and multipara. Now, gravida means how many times you've been pregnant. Para or parity is how many times you delivered a viable infant. Now, for all you future nurses, that's the telephone code. So let's look at that real quick. Okay. So you have these codes like G and P. G means if you see here, gravida, the total number of confirmed pregnancies, and the P, para, or parity, is the total number of births, right, that had post 20 weeks age of gestation, or AOG. Now, a typical mommy goes to 40 weeks, and you can go as far as 42 weeks. Okay, so what's the telephone code? Here you go. Let's use Wikipedia. Why don't we? So gravida, pregnancy, right? So you can have a nulligravid woman. She's never been pregnant. Primigravid, this is her first time to be pregnant. Multigravid, right? That means she's been pregnant more than once. Now, you could do that with parity. So nulliparous, right? Which is this word. Right? Never gave birth to a baby greater than 20 weeks. Primiparous, see if I'm spelling it right. That's a person who's delivering post 20 weeks for the first time. And multiparous, that's mommy who's delivered more than once. A baby greater than 20 weeks age of gestation. Okay? Now, gravida, parity. Where's the telephone code? There it is. TPAL. It's a method for the there's like G4, 3P, and then there's these four numbers at the end. And TPAL stands for how many of those births were live after 37 weeks, which ones were premature, which ones were abortions, and which ones are how many children are currently living. So let's look at I'm almost at low power. Let's look at an example. So my patient could be G2P2. That means she's been pregnant twice and she resulted in a live birth twice. G4P3A1, she's been pregnant 4 times, she delivered 3 times, and one of those 4 times that she's been pregnant resulted in an abortion. Okay, now abortion doesn't necessarily mean voluntary, it could also mean spontaneous. Okay, so like, and that's part of genetics, and that happens. So GP, and then you got TPAL. Okay, it's a little bit of obstetrics. Gravida, parda, salpinx, hematosalpinx. That's blood in the fallopian tubes. That's not good. Stocia is dystocia. That's childbirth labor. So dystocia, mommy knows when of course labor is painful, but mommy knows when it's wrong. So when mommy says something's up, please pay attention to it. Learn that the hard way in more than one occasion. Retroversion. Version is the turning, so tipping back an organ. Now, if you recall the picture of the uterus, it was faced a certain way, kind of like a ramp. Now, just imagine if it's faced the wrong way, baby won't be able to come out of the cervix, won't be able to slide into the vaginal canal easy. So, especially if the cervix and the uterus is pointed the wrong way, and that's called retroversion. Now, version also means that we can also move baby, and you'll learn that in obstetrics. That's not fun. All right, so I'm gonna. Oh, here's the thing regarding. Here's the thing regarding the broad ligament that holds your ovaries, your fallopian tubes, and all of it together. There's your uterus, there's the cervix, and here's your vaginal canal. But let's go back to this. You see how it's curved this way? Now what happens if this was curved back and this hole starts facing this wall? Then that's retroversion, that's not good. Indication, there'll be failure to descend, and then there'll be indication for C-section, also known as a cesarean section. Okay, this now I am totally running out of battery, so kindly go over the cases. Why did I not charge this thing? Kindly go over the cases, and if you have any other questions for this part on to the chapter, please give me a call. All right, see you guys next week. Next week is week 9, and after that, next week maybe we'll start talking about final assessments. I believe your final exam is like an online exam. But I'll have to check into that. If not, I got one. I could send it to you guys electronically, and then you guys have some time to send me back. But I believe it's online. All right, everybody. Thank you very much. All right. See you next week.